A life cut short. Portia Ngumezi's story. Portia Ngumezi had dreams. She was a vibrant woman, full of life and love. At 35, she was excited to welcome a child into the world, but tragedy struck. Portia suffered a miscarriage. What should have been a time of mourning and healing turned into a nightmare. Portia's miscarriage led to complications. She needed medical care, but she was denied the standard treatment. Portia Ngumezi died on June 11th, 2023, at a hospital in Texas. Her death was preventable. It was a direct result of the fear and confusion sown by Texas's restrictive abortion laws. Portia's story is not unique. It is a stark reminder of the human cost of legislation that interferes with medical decisions. Her death underscores the urgent need to address the chilling effect of such laws on doctors and hospitals. We must examine the systemic failures that disproportionately impact Black women like Portia. We must demand better for mothers, for families, for all. Understanding D&C, a safe and common procedure. Dilation and Curettage, or D&C, is a common medical procedure. It is safe and effective. Doctors use it to treat a variety of conditions, including miscarriages. During a D&C, the cervix is gently dilated. The uterine lining is then removed. This procedure is often necessary after a miscarriage to prevent complications. It helps to stop bleeding and reduce the risk of infection. D&C is considered the standard of care for many women experiencing miscarriage. It offers a faster recovery and lower risk of complications compared to other options. Doctors are trained to perform this procedure safely. Yet, in a climate of fear and legal uncertainty, even standard procedures like D&C are being delayed, denied, or avoided altogether. Texas's abortion ban, a chilling effect on healthcare. In 2021, Texas passed Senate Bill 8, effectively banning abortions after 6 weeks of pregnancy. This law, with its vague language and threat of lawsuits, has created a climate of fear among healthcare providers. Doctors are hesitant to perform procedures that could be construed as abortions, even when those procedures are medically necessary to manage miscarriages. The fear of legal repercussions has led to tragic consequences. Women like Portia Ngumezi are being denied timely and appropriate care. Doctors are facing an impossible choice: provide necessary medical care and risk legal action, or withhold treatment and potentially harm their patients. This chilling effect is eroding the doctor-patient relationship and putting women's lives at risk. The color of care, racial disparities in maternal health. Portia Ngumezi was a Black woman. Her story tragically highlights the racial disparities that permeate maternal health care in the United States. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. This disparity is not due to differences in biology, but rather to systemic racism and implicit bias within our healthcare system. Black women often face implicit bias, lack of access to quality healthcare, and socioeconomic disparities that contribute to these alarming statistics. They are less likely to have their pain taken seriously, less likely to receive adequate prenatal care, and more likely to experience preventable complications. Portia's case is a stark reminder that the fight for reproductive justice must include a fight for racial justice in healthcare. Lost in translation. medical records, and systemic failures. In the aftermath of Portia Ngumezi's death, discrepancies in her medical records came to light. Nurses' notes documented heavy bleeding. These contradicted the attending physician's notes, which described her bleeding as minimal. Such discrepancies raise serious concerns about the thoroughness of care Portia received and the potential for systemic failures within the hospital system. Were Portia's concerns adequately addressed? Was there a breakdown in communication between medical staff? These questions remain unanswered. Portia's case exposes a critical need for transparency and accountability within hospitals. Clear protocols for miscarriage management are essential. So is a system that values and incorporates the observations of all medical professionals involved in a patient's care. A doctor's dilemma, navigating fear and medical necessity. Doctors across Texas are grappling with the fallout of SB 8. They are caught between their oath to do no harm and the fear of legal ramifications. The law's vague language and broad scope leave them vulnerable. Many fear that even providing standard miscarriage care could be misconstrued as performing an illegal abortion. This climate of fear is forcing doctors to make impossible choices. They are delaying necessary procedures, transferring patients to different states, or even leaving the field of obstetrics and gynecology altogether. The consequences for women's health are dire. Texas needs clear guidelines that protect doctors who provide medically necessary care, even in cases where pregnancy is not viable. Beyond Portia, a growing crisis in women's health care. Portia Ngumezi's story is not an isolated incident. It is a tragic example of a growing crisis in women's health care. Across the country, restrictive abortion laws are having a ripple effect, jeopardizing the health and well-being of women, even in cases unrelated to abortion. Miscarriages, ectopic pregnancies, and other complications are becoming increasingly difficult to manage as doctors fear legal repercussions. This is not just a Texas problem. It is a national crisis. Women are being denied life-saving care. Doctors are being forced to compromise their medical judgment. The fundamental right to bodily autonomy in healthcare is under attack. We must fight back against these harmful laws and protect women's access to comprehensive health care. Breaking the silence, demanding accountability and change. Portia Ngumezi should still be alive. Her death was preventable. It is a stark reminder of the human cost of political agendas that interfere with health care. We cannot remain silent in the face of such injustice. We must demand accountability from lawmakers who prioritize ideology over women's lives. We must hold hospitals responsible for creating a climate of fear that prevents doctors from providing necessary care. We must challenge the systemic racism that continues to plague maternal health care. We must break the silence surrounding miscarriage and other women's health issues. Fighting for a future where motherhood doesn't mean martyrdom. Portia Ngumezi's legacy should be a catalyst for change. We must honor her memory by fighting for a future where motherhood doesn't mean risking your life. We must demand policy changes that protect women's health and ensure access to safe, legal, and comprehensive reproductive health care. We must elect leaders who trust women to make their own healthcare decisions. We must support organizations fighting for reproductive justice. We must educate ourselves and others about the impact of these harmful laws. We must never stop fighting for a future where every woman can access the health care she needs without fear, without judgment, and without exception. If you would like to share your story or show support of Black maternal, fetal health, and reproductive justice, comment under this video, and don't forget to like, share, and subscribe.